Hi, this is Dr. Al Power. Glad you're with me today. I just wanted to share some thoughts about what I've been discovering during the past 6 months of this coronavirus pandemic. We've had a lot of time to sit and think, to reflect, and for a lot of people, there's been a lot going on. There's been a lot of tragedy, a lot of difficulties, a lot of hardship. There's been some pain. There have been lessons learned. There have been many missteps along the way by different groups, and really what should have become a widely public health initiative has been very heavily politicized. But I've been asked a lot to speak about what can we do, particularly in long-term care, or as it's called in other countries, residential care, and in particular, how can we better support people who live with a diagnosis of dementia. And the amazing thing I've discovered with all the talks and all the reading and all the thinking I've been doing about this is that a lot of what we need to know, we already know. We've been teaching about this with Eden in the culture change movement. We've heard about it at Pioneer Network conferences. I've written about it in my books. There are some things that have been shown to help people to do better in times like this. But we just have not had enough of the collective will, enough movement as a nation to get these things done. So I just want to review a few of the things that I've discovered along the way that I think just need to be repeated a few more times. One group that I've learned something from is a group called Schlegel Villages, a set of 19 communities around Ontario where I work part-time. And I was meeting with a group of neighborhood leaders at Schlegel Villages earlier in the summer, and they were talking about the fact that several neighborhoods that had many people living with dementia actually found that people were calmer and more content during the pandemic than they had been in the months leading up to that. And so we analyzed that and said, why is that happening? And guess what we've learned? First of all, relationships are important. What happened was team members were being cohorted so that they were not going from neighborhood to neighborhood, potentially spreading infection. So what happened is there was much more consistent assignment. People were getting to know each other better, and that was two ways. The people with dementia were being more familiar with the faces that came in the room, even faces wearing masks, understanding voices. And the people who were supporting them were beginning to look beyond their words or their lack of ability to call up memories and understand them better, to know what their needs and preferences were. And this was working better. Also, there was a decrease in large group activities because they couldn't do those anymore. So a lot of the times when you herd a lot of people into a big activity and many people cannot really engage in that, that leads to some distress. This wasn't happening. Much more engagement was happening one-to-one or in small groups. And because there were not the big congregate meals, people were starting to follow the rhythm of the elders more carefully. That's something Joanne Rader wrote about probably 30 years ago in her book, Following the Rhythm of Elders. And now this was happening. There was a lot more commotion, fewer people cutting through neighborhoods that didn't have a purpose there or a relationship with the people there. Family visits, when they began, were more spread out. They weren't just everybody coming in creating commotion. So there were many things that we know about that can help that were actually working that happened as a result of the isolation precautions that were going on during the pandemic. The other group I learned a lot from was the Greenhouse Project. And the Greenhouse Project is doing an ongoing study with the University of North Carolina where they are looking at their COVID experience. And what they are finding, 2/3 of the way through the study, is that greenhouse homes, the small house model, has far fewer infections and far, far fewer deaths. As of this speaking, their infection rate is only 20% of the national long-term care rate, and their death rate is only about 4%. In other words, the national long-term care death rate from COVID is 25 times as high as it is in those nearly 300 greenhouse households that are being studied. Now, there are many similar things going on here. There is consistent staffing in most of these houses. There are not agency staff. They're not people floating from one community to another. And this is really important when it comes to stopping the spread of infection. Also, the greenhouse model says private rooms. We've been talking about private rooms for years. We've talked about it as a dignity and privacy issue, human rights. We've talked about it as an infection control issue with other infections, such as MRSA, such as Clostridium difficile infections, such as influenza. Maybe now with COVID, we'll start to learn what I wrote 7 years ago, which was that no new building or renovation should be considered unless everyone should be given a private room. We have also learned that once again, these small households have a lot of individual engagement. They have central living spaces where people can have meals socially distanced because people can sit at the dining room table, a few others can sit at the bar by the kitchen, a few others can sit in the living room, and all be within eyeshot and often earshot of each other. So structure matters, not only operations, but physical structure. Small households with these types of designs can help. Direct access to the outdoors, which is another part of this model, was also very important for getting people a place where they can walk, where they can get fresh air without necessarily being crowded together. So there's so much that we have already known that we are finding during the pandemic is strong for us. Now we've got some new guidelines from CMS. Once again, I don't think they go as far as they could. They talk about cohorting residents during COVID. They don't talk that much about cohorting staff. They still talk about things like staff working at many different communities instead of doing what Canada's doing now, which is looking at pay inequalities between long-term care and acute care and trying to do something about that, looking at better, fair pay and benefits for those people that do this hard work, and also looking at finding ways to give people full-time work within one organization so they don't have to go to 3 different communities in order to fill their 40-hour work week. So there are many things we can be doing at the provider level, at the regulatory level, at the reimbursement level, as well as at the public health level. With flu coming soon and the cold season, we're not going to see any relief anytime soon, but there are some things that we already know. And some of these things like new builds can't happen right away, but some of these other things like keeping our dedicated staffing assignments, building relationships, following people's rhythms, working with more individualized engagement. These things are things we've been talking about for years. We can do these now, and we can greatly impact people who are living with dementia and people who are living in long-term care. One last point, and that is that the Greenhouse Project, by and large, does not segregate people living with dementia. So all this thought about the fact that we have to separate people with dementia to prevent the spread of infection doesn't wash when you look at their data, which shows far, far lower infection and death rates in integrated households. So once again, the fact of dementia is not the issue. It's the fact of structure. It's the fact of operations. It's the fact of relationships. So let's look back at the lessons we've learned. Let's find ways to bring them to bear as we move into the winter season, and let's make plans to truly transform our support of elders as we move into 2021. And lastly, please, everyone, get a flu shot. Thanks again for listening.